Today, we formally launch NHS Test and Trace. This is an incredibly important milestone for the country, and I know people will want to hear about it. Before I do, I'd just like to update you on the latest coronavirus data. 3,798,490 tests have now been carried out in the UK, including 117,013 tests yesterday. 267,240 people have tested positive, which is an increase of 2,013 cases yesterday. Of those who tested positive for coronavirus across all settings, 37,460 people have sadly died. And since yesterday, 412 deaths have been recorded. We mourn them, and we will not forget them. As I said yesterday, thanks to your effort and sacrifice, we are past the peak. We flattened the curve, we protected the NHS. And the big question that we're all working to answer is this. Until an effective treatment or vaccine comes through, how can we get back to doing more of the things that make life worth living without risking safety or putting lives at risk? NHS Test and Trace is a big part, not the only part, but a big part of the answer to that question. NHS Test and Trace means we can start to replace the national lockdown with individual isolation for those who've been in contact with the virus and local action where it's necessary to respond to a flare-up. The concept is simple. First, through testing, we hunt down the virus, finding out who is infected right now. And I use we very deliberately because we all have our part to play. This is a national effort and we all have a role. If you have symptoms, you must isolate immediately and get yourself a test. Yesterday, 2,013 people tested positive, and the next step is that through contact tracing, like detectives, the NHS clinician from NHS Test and Trace and the person who's tested positive work together to identify the possible movements of the virus, where it's been, and who else it might have infected. Then we isolate those contacts who might have been infected so the virus is unable to spread and we break the chain of transmission. Think of it like this. The virus exists only to reproduce. That is its sole biological purpose, to make as many copies of itself as possible. If we can thwart that purpose, we can control the virus and ultimately defeat it. We must all follow the NHS Test and Trace instructions because this is how we control the virus and protect the NHS and save lives. Some people have asked, why now? Why not launch this programme earlier in the course of the pandemic? The answer is because we needed to flatten the curve. Right at the start of the epidemic, we had a contact tracing system in place, but as the virus raged towards its peak, the number of infections grew so large that we needed a national lockdown. That was the only way to get it under control. Effectively, everyone in the country was contacted and told to stay at home. Now, we've got the number of new infections each day right down, and the number of contacts of those who've tested positive is small enough that we can be in touch with everyone who we need to. And of course, testing capacity is critical to making this work. We now have the capacity for 161,000 tests a day. And because of that increased capacity, I can announce that we're expanding eligibility yet further. From tomorrow, we're expanding eligibility for testing to include the under 5s, so that now every single person who has symptoms of coronavirus can get a test, no matter their age. And what's more, to make NHS Test and Trace as effective as possible, it is very important that everyone with symptoms must isolate immediately and go and get a test.